Well, good afternoon. It's nice I have the chance to be here at the beginning, and now as we move toward the final couple sessions of the day, to come back. We have a terrific panel here. Dr. Pauline Williams is the Senior Vice President and Head of Global Health Research and Development at GlaxoSmithKline, where she focuses on malaria, TB, and other non-communicable diseases in sub-Saharan Africa. Through most of her career, she focused on early drug discovery and development. And among her achievements are initiating and leading a project to develop a gel that is used to prevent neonatal sepsis, which is now used in 7 countries around the world. She's also a fellow of the faculty of the Royal College of Physicians and a council member of the UK Medical Research Council. And next to her is Keun-Tae Park. Mr. Park is the CEO of CJ Logistics, which is the largest logistics company in Korea. He also spent 30 years living in China and is the CEO of CJ China, a very large corporation there. And we're very pleased to have both of them here to talk about some very interesting shared value initiatives that they've each been involved with. So let me start by asking Mr. Park, if he would, to describe to us the initiative.
Good afternoon. I'm Keun-Tae Park of CJ Logistics and CJ China CEO. I'm excited today to be here today to share our senior parcel delivery service. Let's take a look at this picture first. This picture was taken during the Korean War. Their face showing the pain of war, and we know from the picture that the children in this generation most probably did not have the luxury of an easy life. This generation who were affected by the Korean War are our aging population today. And despite Korean experiencing fast economic growth, still 50% of South Korean aging population is fighting yet another war called poverty. South Korea's per capita GDP is 30,000 US dollar, but Korea's senior poverty rate is 4 times higher than other OECD countries. So what's causing this poverty? Korea's post-war resulted to poverty causing young adults to enter the labor force instead of going to school. But the rapid economic growth in the 70s changed the education paradigm. Parents realized their children needed higher education to succeed in the new economic era. The children's success was put before anything else. As a result, parents was giving up their retirement as well, becoming what we call ed-poor. Families facing financial hardship due to overspending in education. At CJ, we saw this as an opportunity to create a new wave of economic and social progress by solving the social problem. Because creating culture is what CJ does best. As Korea #1 lifestyle company, we lead industry in 4 main business areas. First is food and food services. Second is bio and feed mill. And third one is entertainment and media and multiplex cinema. Last is retail and logistics. CJ Logistics is CJ's main affiliate and Korea's #1 logistic company. Our core business and parcel delivery, warehouse and distribution, and port and delivery and freight forwarding. CJ was built on our founding philosophy called 공전공영, meaning coexistence, which actually is similar to creating shared value. let me share with you how we applied coexistence and CSB principle to our logistic business. This is a picture of Korea's second largest city, Busan. Beautiful ocean and building. However, behind the scene, you will find very crowded residential areas. Well, this was where it all started. You can see from this picture, such areas are almost impossible for cars to enter, making it very difficult for parcel companies to do delivery. And this was a challenge for us as well. But today, with our senior parcel delivery service, we are able to solve this issue and at the same time practice our coexistence value. So how does senior workers and parcel delivery work? Normally, a parcel delivery worker will drive a truck into the areas where they make delivery with an average of 300 packages a day. But this method is too straining on the senior workers. So we innovated the process by creating drop points instead of crowded areas. When the delivery worker drops off the package at the designated drop point, the senior workers will pick them up and deliver the package to the customer's doorstep. Through this process, we were able to reduce the physical burden and the safety issues of our delivery worker, and also created new job opportunities for our aging population who needed financials to support their life after retirement. As a result, we created 1,400 senior jobs in the past 5 years. And this is a very sustainable business model because the senior workers were able to earn twice more than government subsidized jobs. We created a new culture for our aging population to ensure a stable retirement life. And we went further to get one step closer to our customers by providing eco-friendly logistics solutions such as electronic cards for delivery. This success would not have happened without the help of our various stakeholders. And we think this is a great example of a collective impact. Today, we are on another journey. There is a Korean folktale called The Blind Man and Lame Man. The story shares how two individuals collaborate to overcome their disabilities. If you look at the picture, we have a young man who is illiterate. The lady beside him is able to read, but she is unable to carry package due to her physical disability. However, what happens when they work together? We've created a new business model and opportunity for people with developmental disability. Like our company slogan, Live New. CJ continuously strives to create new culture where our coexistence philosophy is the core of our business strategy. I hope you enjoyed my stories today. Thank you very much.
Dr. Williams, please. Thank you.
Thank you. So, as Mark said, my role in GSK is head of the Global Health R&D organisation in the pharma part of GlaxoSmithKline. And I've been with that company for well over 20 years, which makes me feel very old, but I'm relieved to know that I've got a job in CJ Logistics at some point. But the reason that I've stayed with the company so long is that I totally buy into the notion that shared value is implicit with the mission of GSK, which is to help people do more, feel better, and live longer. And our new CEO, Emma Walmsley, has taken over from Andrew Whitty, who was a great advocate for global health. And I think a lot of people internally to GSK and externally were saying, you know, is this going to herald a change in GSK's commitment in what has historically been seen as a low commercial opportunity? And I think Emma has been very explicit that she is very proud to work for a company and continue that heritage. But is starting to bring some additional business imperatives across the organisation in terms of increasing innovation, performance and trust. I think many people might think that a global health R&D commitment would fit firmly in the trust bucket. But I think that what I want to talk about is actually how we can demonstrate that it is part of the innovation of R&D that does have shared value, performance, and you know, it does have trust as well. From the innovation perspective, I've got a team of about 150 clinicians and scientists working from discovery right through to development. In fact, we have a medicine for malaria Vivax, tefenoquine, that's currently being reviewed by the FDA. And our work ranges from malaria, TB, neglected tropical diseases, and maternal and neonatal health. And there is world-class science, and we publish in top journals, and we're recognised as one of the leaders in the field globally. We also have pioneering open innovation models that allow academics to come in and work alongside our scientists in open labs. We screened more than 2 million compounds in our chemistry library and published the data on 13,500 hits that go into malaria box for other people to work in this space. We think this is all good for business and the greater good. We also have technological advances, innovations such as the adjuvant that was used in our malaria vaccine has now been adopted in the Shingrix vaccine. So things that were originally developed for global health are now being adopted for highly profitable and commercial opportunity. I also have to present my science and business plan for my unit in competition to what's called the Discovery Investment Board. So that's like a dragon's den. So we have to compete with all of the other units for a 3-year business plan to say, what are we going to do and what's our return on investment? And I'm lucky to work for a company that recognises that social impact counts equally against commercial impact. And that once I'm given the budget and the priority, I'm then working in a level playing field with the rest of the organisation. Performance, I think we have to show discipline of efficient development plans. We have to have partnerships, share risk. We have to think about novel solutions designed to access by first intent. And also I think the capacity building that comes with working in low resource settings is ultimately going to benefit for future generations in terms of increased levels of research excellence and things like pharmacovigilance when our medicines reach those targets. And trust, I think clearly there is a component of external reputation. We're really proud to be at the top of the Access to Medicines Index, recently the Antimicrobial Resistance Index, and previously Fortune Changed the World. There's also an element of what I would call science diplomacy. I mean, I think there's great value in peer-to-peer connection in terms of working in science partnerships with key opinion leaders in our target countries, with the governments and with supranational organisations. And I think you can cut through a lot of the politics just by talking about great science and benefit to patients. And then finally, employee engagement. And I'll just finish with a little vignette, and may talk about this example more in the questions. But I started a project that Mark alluded to, which is just to actually talk about cutting-edge science. This is probably the simplest thing from a technology perspective, which is an antiseptic to put on the newly cut umbilical cord, which is a major route of infection in low-resource settings. And data had shown that use of this antiseptic at a high concentration reduced neonatal deaths by about 25%, 23%. And so GSK made this into a gel and went through the regulatory process. And I had the honour of going up to the factory that was producing it up in the north of England, and we're rigged up completely head to toe in all the sterile gear, and all I could see of anybody was just eyes poking out of a blue hood. And the gentleman that was running on the chlorhexidine factory floor, running the gel into the sachets, came up to me, and there were tears in his eyes, and said, you know, I've worked here for nearly 30 years, and he said, and all I've done is make people do more and feel better. He said, but now I'm making people live longer and I'm saving lives. And I don't think you can put a price on that benefit. So I'll leave it there, and I guess we're going to be questions now.
Yes.
Thanks.
Yes. Thank you very much. So we have about 10 minutes left. I have a few questions, but you all are experts in Slido by now. So please send your questions in by Slido, and we'll be able to ask the panelists. But Mr. Park, let me start with you. You've made the Fortune Change the World list because of the Senior Delivery Project. What was the most innovative or challenging part of launching that project?
I would have to say is the innovation of our business process. By creating a sharing platform, we were able to divide the workload from one to multiple. Therefore, we were able to reach out a bigger pool of senior workforce and create a sustainable business model that benefits both the company and our society by providing our aging population with a secure post-retirement life.
Terrific.
Yeah.
So you really needed to change how you thought about the delivery system
Yeah.
from a single route
Yeah.
to this divided up system to enable you to employ the seniors.
Yeah.
And I understand it has had positive business benefit for you in terms of market share and so on. Can
Yeah.
you speak to that?
Actually, CJ Logistics, we have a market share in Korea. Parcel delivery case is about 46% of total market. And then every day we are moving 17,000 vehicles of 1-ton truck. And every day we are moving 5 million box. There is a normal delivery. After retired, our senior parcel delivery case is after 65 years old, after retired age, up to 75, somebody is 80. They already retired, stay at home, and then they delivers drop point. We made to their designated apartment, and then we will deliver some goods their apartment, drop point, and then they will deliver every day around each person 200 bucks, something like this.
Terrific.
Yeah.
Thank you.
Yeah.
Well, Dr. Williams, you know, I'm fascinated by this dragon's den, which sounds very scary. And, you know, you have to present your 3-year business plan. The other business units, which are focused more on profit, have to present their business plan. And you said it's a level playing field. And yet your return is really around health outcomes and social impact, not necessarily the financial bottom line the way theirs is. And so how do you make a level playing field when one side is a social benefit and the other side is a financial return?
So, I mean, it's a great question, and I think that the benefit of working in research and development is that it actually is going to take a long time before any benefit comes back to the organisation. So we are, by definition, the loss part of the organisation. And so I think there is an appreciation that actually in that conversation, what you're doing is actually demonstrating the quality of your science and the opportunity to have an impact on health. And so it's very much at the patient benefit. And at that point it then diverges, because once you've achieved that health benefit, there may be some opportunities where there's commercial gain yet to be realised, and then certainly in the areas that we're working, less so. So we then have to demonstrate how we can not only achieve that health benefit, but how we can do that in the most efficient way, how we can work in partnership to enable that medicine to reach the beneficiary and have the impact. But I think that is why working embedded in an organisation that appreciates and has the sophistication to be able to make the distinction. So we're not ring-fenced, it's not the sort of CSR part that has a kind of capital allocation and go off and spend it and do good stuff. I think, to me, it's really important that we are on that level playing field.
Yeah, terrific. Well, let me build on what you mentioned in terms of partnership. So this is done in partnership with Save the Children, which is a wonderful nonprofit organization, and their CEO is actually on FSG's board. But what are the sort of challenges that you find in working in partnership with a nonprofit?
Yeah, so not everything that we do is in partnership with Save the Children. So we work with multiple NGOs. But I mean, I think certainly, I think in terms of, well, I mean, I must admit, when the Save the Children partnership was first launched within GSK, and it was told that it was a shared values partnership, I thought that meant that we both had values that were, about doing good for patients. And so it was the shared value piece, I think, came as a bit of a learning curve for me. In terms of challenges of working, I think we've had to work through different perspectives, I think, different cultures, perhaps some mutual suspicion. I think there was one example that was before I got involved, which was when I think the GSK Save the Children partnership was just first in discussion, and they were each asked to draw what they thought each other thought of it. And I think the GSK people drew the Save the Children as tree huggers, and the Save the Children drew the GSK as sort of corporate sort of monsters, and so you had to break down a lot of those barriers. But I mean, I think ultimately, when you get down to the fact that you are trying to do the same thing, then it actually becomes much easier. And also recognising that we're each bringing very different skill sets to the table. We could not have taken the chlorhexidine project to where we did, and the speed that we did it, and the quality, without the input of Save the Children. I heard the example between J&J and PATH earlier, and similar things in terms of the TB exercise in Vietnam, the two bringing different skill sets. And I think that's definitely a model that we need to pursue.
And we do see these shared value partnerships developing between companies and nonprofits, where they each have complementary skills. But I think, what you joked about in terms of the corporate monster and the tree hugger is a very real sentiment out there, and is one of the real challenges to overcome. Well, one of the questions that has come in is about how shared value works at the business unit level as opposed to the overarching corporate level. And of course, both of you lead business units. Mr. Park, you also lead CJ China, which has multiple business units within it.
Yeah.
So how do you think differently about shared value in the logistics, which is a single business unit, compared to CJ China, where there are different business units?
Yeah. Actually, our CJ group, we have some philosophy. Our CJ group founding principle called 사업고국, which means the company must contribute to the nation and further progress the society through the business. That's why each unit, like CJ Logistics, we have created that kind of senior parcel delivery. And CJ China, we have another shared value project, like some China, some poor students. We are rebuilding of some school class and also supporting to them, and that kind of a shared value program.
Good, thank you. And Dr. Williams, you also are a business unit within a larger group. And have you encountered resistance or the need to change mindsets because of the larger corporate culture, or it sounds like it's fairly aligned?
No, I mean, I think occasionally we've come across single individuals. So I talked about working on a level playing field in the Dragon's Den and accessing then resources equally with commercial projects. But I think occasionally we've come across individuals who have made their own prioritization decision. They may have their own line supporting a project may have a kind of resource crunch, and they've got to make a judgment between one project and another, and they've assumed that the commercial project will take precedence. And we've had to really work hard to say, no, that that's not what's happening. And then the opposite end of the scale, I think some people perhaps think that we have a divine right to be spending as much as we possibly can in global health, and actually resent the fact that we're putting some business discipline behind it and are talking about return on investment. And some people who feel that perhaps it's wrong to make a profit on some of our medicines. And I think that those are some examples at different ends of the spectrum.
Terrific. Well, thank you. And I'm afraid, unfortunately, we're out of time. It's a very short panel. We could have talked much longer. But please join me in thanking Dr. Williams and Mr. Tae. Thank you.